Hi everybody, it's Gaynor Morgan from Pelvic Angel here, and today I just want to mention one of the pessaries which I particularly like. It's called the Popy, and it's made in the United Kingdom by a company called MediPlus UK Limited. So this is the Popy, and it has a stem, so it's got a long stem and a short stem. And again, this really depends on the discussion you have between your clinical provider who is going to fit the Popy Pessary and whether it's comfortable or not with regards to whether you have the long stem or short stem. Now, a lot of women, they do have a particularly long vaginal canal, so your provider will probably start off in this case using the long stem. If you're somebody that, let's say, does a lot of horse riding, does a lot of impact sports, if you are a weightlifter, then you may just want to talk to them about having the short stem. So it's made out of medical grade silicone, and the duration of time to be left in the body is no more than 3 months continuous use. However, this will depend on what your medical provider will suggest. So why would she suggest having it removed every month, for instance? Well, a lot of women, as they get older, and again, this isn't for the older generation. A pessary doesn't have an age to it. A pessary can be fitted to any adult female. So whether you're 18 years old or 80 years old, but as we get older, the estrogen depletes in our body, and this tends to make then the vaginal lining susceptible for breakage, or if you've got anything in there that may rub against it, it can cause abrasions. Now, when somebody's got atrophy, your medical provider then may want to see you a lot sooner than 3 months, just to make sure that the pessary itself doesn't start rubbing against the lining and causing any abrasions. If you do have atrophy, please do talk to your medical provider about estrogen, because the estrogen can then plump up the tissues, and it makes it more manageable and more comfortable for wearing a pessary. So when you insert this, and again, it should be inserted by your medical provider. And if you are intending to self-manage this, then have your provider teach you properly how to remove and insert this pessary. We always use water-based lubricant with any silicone product. So all the pessaries, the majority of pessaries are silicone. A lot of them are PVC, and again, I would also opt for water-based lubricant on that occasion as well. So you're going to put the water-based lubricant on the leading edge, and then you will fold this. So it's very flexible, as you can see. So this is going to be folded for you to insert. So as you insert it, you're going to take the non-dominant hand, open the labia, then with the dominant hand, you're going to fold this. So this little stem here, that's going to support the bladder neck and the urethra. So in my model here, this little dip, I don't know if you can see that, the little dip here, this is going to sit on the pubic notch or the pubic bone. And then that then will just comfortably, then the little stem will comfortably support the urethra. So it can be used in cases of urinary stress incontinence, And if it's complicated by a pelvic organ prolapse, such as anterior wall, so we could have the cystocele where the bladder starts to descend down. It can be used for uterine prolapse as well, where the uterus and then obviously the cervix, if you have a cervix, would come down. And in some cases, it can be successful for erectoceles, where the posterior wall starts to descend down. So I would find this probably most useful when you have an anterior wall prolapse, complicated maybe by urinary stress incontinence. Once you use this pessary, the first time that you have it, your patient, or if you are the patient, you may find cramping pains, you may find a little bit of lower back pain, you may find that you have period-like pains, even if you are postmenopausal and don't have any periods anymore, you may have that cramping period-like pains. This should not last more than 12 hours, maximum 24 hours, and it should not be unbearable. So even though you've got cramping pains, you would be able to cope with it. So a mild analgesia just taken to take off the edge of the cramping pains. Even sitting in a bath with magnesium salts can also help alleviate that cramping pains. Now, when should you report back to your doctor? So let's say you've had it fitted in the morning and you wake up the next morning and there's a thick yellow-green discharge coming from the vagina, then I would call the doctor immediately. If you've got a foul smell coming from there, then again, it's time to call the doctor because this could indicate that there's an infection there. If you have any vaginal infections or urinary tract infections, then we would not fit a pessary at all. This is a contraindication, so you have to wait until any infections have cleared up before using a pessary. The other thing that you need to inform your doctor immediately is that if you try to void, so when you try to urinate and you can't urinate, so it could be that the pressure against the stem here, or it could be that the pessary is simply too big and that then stops urination. The pessary has to come out immediately. It does cause suction. So when you remove the pessary, you're going to take your finger over that little lip there, and you must break the suction first before bringing the pessary out. And you can use the stem as a guide to bring the pessary out. Take your time with removing it, because as it has a suction, the last thing you want to do is to draw down any descent of the organs even further. If you've got any questions whatsoever, please get in touch. I am a pessary expert and I do train medical professionals in pessaries. So our next course is in October 2024. So if you need any CPD training, please do get in touch.